I was so weak and shaky. I hardly had any voice. I tore my Achilles tendon. There was a hump on my neck. My skin on my whole body was like a 90-year-old woman. Just like I was aging, extremely aging. I was scared, I really was.
I'm watching her fall apart before my eyes.
The moment she walked into my office, I knew exactly what was wrong with her. She was really a prototypical patient for Cushing's disease. Cushing's disease essentially is a hormonal imbalance in which our pituitary goes haywire, so to speak.
When I first met Dr. Zerris, I had the feeling of total trust.
He's just somebody that I liked immediately.
We knew that it was going to all be okay that very day.
Debbie's tumor is this little area right there, no bigger than a little pea. But a little tumor like that can really wreak havoc throughout your entire body. Debbie had doctors from many specialties involved in her care. Because we specialize in minimally invasive endocrine pituitary surgery, we actually get a lot of patients referred here for that disease. Debbie understood the benefits of minimally invasive surgery and wanted to proceed with an endoscopic resection of her pituitary tumor.
It is a very scary thought that you're going to have your brain operated on. He was just right there with us, like a family member. He said, I'm right here with you. Don't be scared, I'm going to see through this.
With endoscopic surgery, we sneak an endoscope through the patient's nostril and slowly navigate all the way underneath the pituitary gland right here. With the endoscope, once you actually remove what you think is tumor, you can actually get inside the resection cavity and see if there's any tumor left behind. And I think that makes all the difference. That's what allows us to have superior results. We're able to treat brain tumors, back pain, leg pain, arm pain, through the use of minimally invasive techniques.
I feel fantastic today. My life was saved, the pituitary was saved, tumor gone, Cushing's gone, so it was all worth it, whatever I had to do.
All of the doctors, the support staff behind them, all of them just made us feel so safe and made the whole thing so much better than it could have been. The simple fact that here in Temple, Texas, we have a place like Scott White is just amazing.
Dwayne, after the surgery and when we came home, he said, you ought to make Dr. Zerris a quilt. And once he said it, it was like, that's what I'm gonna do. I loved giving that to him. Anybody that makes a quilt kind of knows what all goes into it, a lot of thought and a lot of time, and it doesn't even compare to what he could do, what his knowledge and his everything that he knows how to do to take a tumor off my brain. But it's my best way, you know, hands-on, that I could do something for him. I still get to have years ahead to be with my family, and I'm so thankful for my health, for Dr. Zerris, you know, for Scott and White.
Debbie and Dwayne are just really wonderful, and to feel her gratitude makes it all worthwhile.